Dilapan-S is an FDA-cleared, non-pharmacologic mechanical cervical dilator designed for predictable, safe, and effective cervical ripening prior to induction of labor. Each Dilapan-S rod is intended for single use by a qualified healthcare professional. Always follow accompanying instructions for its use and handling to minimize exposure to conditions that may jeopardize the product, patient, or user. Dilapan-S is contraindicated in the presence of clinically apparent genital tract infection. Dilapan-S is a synthetic hydrogel cervical dilating rod comprising anisotropic xerogel of aquacryl, a polypropylene handle with a collar, and a marker string to indicate the rod's location. The rod is placed in the cervix under direct visualization. The point of maximum insertion is the line where the dilating rod meets the collar. The rod expands as it absorbs moisture from the cervix, resulting in gentle, uniform opening force to the surrounding cervical tissue. Equipment recommended for Dilapan-S insertion includes 2 sponge forceps, a bivalve vaginal speculum, sterile water or saline, antiseptic solution, gloves, and up to 5 Dilapan-S rods. The number of rods used will depend on the individual patient factors. Typically, 3 to 5 rods are used. First, insert a bivalve vaginal speculum and prepare the cervix with an antiseptic solution. Then, remove the Dilapan-S from the sterile packaging using sterile technique. Moisten Dilapan-S with sterile water or saline to lubricate its surface prior to insertion. Insert Dilapan-S in the cervical canal gradually and without undue force, ensuring that the rod traverses the internal cervical os. Do not insert Dilapan-S beyond the rod collar. After placement, the border of the collar should rest at the external os. As many dilators as needed to achieve the desired effect should be inserted. The specific number of rods will depend on the clinical judgment of the treating provider and should be recorded. Gauze pads moistened with sterile water or saline may be inserted to assist in keeping Dilapan-S rods in place. Careful placement of the rod is essential to avoid traumatic injury to the cervix or uterus, and to avoid migration of the rods upward into the uterus or expulsion downward into the vaginal canal. The patient should be instructed that it is necessary to return for removal of Dilapan-S at the indicated time. The rod should not be left in place for more than 24 hours. Under no circumstances should a patient attempt to remove Dilapan-S rods. If any vaginal gauze was used during the procedure, remove it before carefully removing the Dilapan-S rods. Remove Dilapan-S dilators by carefully pulling the marker strings, ensuring all inserted dilators and gauze are removed, and determine the Bishop score. Occasionally, it may be necessary to visualize the cervix with a speculum. If an instrument removal is necessary, carefully remove the rods by grasping the Dilapan-S dilator handle with ring forceps. Do not twist or grasp the collar of the dilators with forceps, as it may cause the device to break. If the dilator is stuck to the tissue, moisten with sterile water or saline thoroughly during removal. Ensure the same number of rods that were inserted are removed. Indications for use. Dilapan-S is for use by healthcare professionals trained in OB/GYN and is for use whenever cervical softening and dilation is desired, such as cervical ripening during term labor induction, or gynecological procedures that require cervical preparation. Important safety information. Contraindication. Dilapan-S is contraindicated in the presence of clinically apparent genital tract infection. Warnings and precautions. Dilapan-S is intended for single use only. Do not reuse, re-sterilize, reprocess, or use if primary packaging has been opened or damaged. Discard after use. Careful placement of the device is essential to avoid traumatic injury to the cervix or uterus. See instructions for use insertion. Do not leave in place for more than 24 hours. Instruct patients to report any excessive bleeding, pain, or temperature elevation, and to avoid bathing, douching, and intercourse. Patients should return to the provider for removal of Dilapan-S at the indicated time and should be instructed to not attempt self-removal under any circumstances. Potential complications/risks. Twisting of device during removal, may cause the device to break. See instructions for used removal. Complications may include device entrapment and/or fragmentation, expulsion or retraction, patient discomfort or bleeding, spontaneous rupture of membranes, spontaneous onset of labor, and cervical laceration. Storage and handling. Store between 15 degrees Celsius and 30 degrees Celsius, and keep away from direct sunlight and high humidity.